So what do we need to do well to score well in communication skills and to score well in history taking? And these are areas that particularly people who have not trained in a Western style system, UK type system or something similar, sometimes struggle with, because the cultural norms of what people expect in communication may be very different in other cultures to what they are here. So how does it work? Well, the examiners, of course, they know exactly what they're looking for in a station that they're examining, but they will have a set of what are known as descriptors. They will have descriptors. So, for example, they might be looking at the candidate explaining a diagnosis to the patient, in this case, an actor, and they're going to score that person on a scale from 0 to 4. And they will have these descriptors. If they feel that the candidate is well below a minimum level of competence in explaining this diagnosis, it scores 0. 1 is above that, right through to well above minimum level of competence, which scores a 4. And 2 is basically what you need to get to pass. So if you get 2, that's the competence of a minimally competent first aid registrar, which, as I say, is the benchmark for this exam. So each domain is marked out of 4, 0 to 4, and then these go together to make the total score for that station, which is always out of 10. And it goes through some mathematics because it has to be weighted with the other domains, etc. as well. So let's dig into exactly how might they look at communication. So let's talk about the communication domain. As I say, you'll find this is present in a very high proportion. I don't know, out of 16 stations, it might be 13 of them or something like that. So what are they looking for? Now, this is just our interpretation. Yeah, this is not from the college, but this is just what we think they're looking for. So what does good communication look like? Well, it needs to be clear. How clear? Remember, the actor is representing a normal patient. Normal patients don't understand medical language, jargon, etc. So how clearly does the doctor, the candidate, explain the medical issues? Particularly when they're dealing with something sensitive, how much does the candidate show empathy and compassion? And this is not artificial by saying things like, I know how you feel, or things like that. This is about, through body language, etc., being able to convey understanding, compassion. Active listening. So we've all seen OSCEs in which the candidate just goes about their own agenda without really listening to the actor, the patient, to find out what it is that the actor, the patient, wants to know. So what should happen is active listening. Active listening is actually listening to hear what the patient is saying. What are they saying? What do they want? How do they see this problem? What are their concerns? Body language. If you're saying one thing and your body language, your gaze, everything about the way you're sitting is saying something different, this causes confusion. So your body language needs to match what you're trying to say. So those are the first few things. Communication comes right through the station in lots of areas. So, for example, in taking a history, the examiners can gather information about how well you communicate, how well you ask questions, how clearly you phrase them, how you listen to the answers, how you clarify the answers when the patient gives the answers. Similarly, in the patient management, when you come to coming up with a plan, of course, you should always have a plan that you arrive at with the patient. It's not, you must go and do this. It's, okay, this is what I think is the best option, and just explaining it to the patient, hearing their opinions, sharing it with them, giving them any alternatives that might be important. Communication comes into your interaction with others. So if it's a team type station, for example, a resuscitation, and you've got a nurse actor or a couple of nurse actors or a nurse actor and a junior doctor actor. They're going to be looking to how well you communicate with them, how clear you are with your team, how you listen to any feedback that they might provide. So those are specific things that might be scored as I just go back through those 2 slides: clarity, empathy, compassion, active listening, body language, and as I say, communication appearing in the various different components. And what we're going to do in a few minutes, we're actually going to look at those things in some videos. I'm going to get you to look at the videos and write some comments about those areas. Okay,